You've been there, right? That dull ache, that sharp little twinge, that throbbing pain in your tooth that you just cannot ignore. It feels like this frustrating, impossible mystery. But for a dentist, a toothache isn't just a nuisance, it's a case to be solved. They basically become a detective, and your mouth, well, that's the crime scene. So let's follow the clues and see exactly how they crack the case. Every single sensation, from a tiny bit of sensitivity to cold all the way up to a full-blown, keep you up at night ache, is a clue. Your tooth is literally trying to send you a message, and your dentist is the one who can translate it. So what is your tooth trying to tell you? Let's crack that code together. Okay, so the first step in any investigation is to gather information. And the most important witness in the room is you. Before a single tool comes out, the dental detective kicks things off by asking a series of very specific questions to build the foundation of the case. That's right, the investigation doesn't even start with a tooth. Nope, it starts with the big picture. Your overall medical and dental history provide all this crucial context the detective needs to separate the real leads from, the distracting red herrings. And this is where things can get really tricky. Sometimes your own body can throw the investigation way off track. For instance, a sinus infection can make all of your upper teeth ache, which is a perfect alibi for a single problem tooth. And other conditions, like diabetes, they affect how you heal, and that can change the entire approach to the case. This is why getting the full story first is absolutely crucial. So once the background check is done, the interrogation begins with the most direct question of them all. Can you point to the exact source of the pain? If you can, that gives the detective a huge lead. It lets them focus all their follow-up tests on one primary suspect. And this isn't just some random chat. It's a structured interrogation. It's built on 5 key lines of inquiry that help the detective build a super precise profile of the pain. It ensures no clue gets missed. Each one of these questions uncovers a totally different type of clue. Beginning tells the detective if it's a brand new problem or a chronic one. Intensity separates a minor annoyance from a major emergency. Provocation is critical. What makes it hurt? Is it heat, cold, biting? And duration? Honestly, this might be the biggest clue of all. Does the pain vanish instantly, or does it hang around? That single detail can change the entire direction of the case. All right, with your testimony officially recorded, the detective now moves on to the physical evidence. This is the hands-on examination of the crime scene to verify your story and, uncover clues you might not even know are there. 2 of the very first tests are palpation and percussion. Think of it this way. Palpation is kind of like checking the foundation around a house for weak spots by pressing on the ground. Percussion is more like tapping on the walls to see if anything rattles. One checks the bone and gums, the other checks the tooth's immediate suspension system. Next up, the detective checks for mobility. A healthy tooth? It should be rock solid. A loose tooth means that its attachment has been compromised somehow, either from an infection spreading out from the tooth or from a completely separate gum issue. It's a major sign that the support structure is in trouble. They'll also do some periodontal probing, which is just measuring the space between the tooth and the gums. And get this, finding one single isolated deep pocket is a massive clue. It's like discovering a secret tunnel, which suggests an infection from inside the tooth has found a way out. Now, with the crime scene examined, it's time to interrogate the main suspect. Okay, now we get to the really cool stuff, the high-tech forensics. After examining the scene, the detective puts the suspect, the tooth itself, under the microscope. These tests are specifically designed to interrogate the nerve deep inside to find out if it's healthy, injured, or worse. The most reliable way to make that tooth's nerve talk is with a thermal test, and cold is the tool of choice. By applying a quick little blast of cold, the detective isn't just checking to see if it hurts, they're listening very, very carefully to the nerve's confession. This right here, this is where the case often breaks wide open. You see, it's not about if it hurts, but for how long. A sharp pain that vanishes almost instantly, that's actually great news. The nerve is irritated, sure, but it's healthy enough to recover. But a strong pain that lingers for seconds or even minutes after the cold is gone, that's the nerve's distress signal. It's telling you the inflammation is so severe it can't heal itself. And no response at all? Well, that often means the nerve has already died. Of course, a good detective needs to see what's happening behind the scenes, right? An X-ray is basically like a surveillance photo of the area. It allows the dentist to see the root of the tooth and, most importantly, the jawbone all around it, looking for signs of trouble that are totally invisible to the naked eye. The X-ray can reveal some critical evidence. The detective is looking for a widening or even a break in that thin white line around the root, which signals inflammation. Or they might see a dark shadow at the root tip, which is sometimes described as having a hanging drop of oil look. That is a classic sign, a dead giveaway of an abscess where bone has been eaten away. So at this point, the detective has all the evidence. They've got your testimony, the physical exam, the forensic tests, and the surveillance from the X-ray. It is time to put it all together and deliver the final diagnosis, the verdict. Verdict number 1. Reversible pulpitis. This is the good news scenario. The nerve is inflamed, yeah, but it's not permanently damaged. That sharp, brief pain from the cold test was the key clue. So the treatment is pretty straightforward. Remove the cause, which is usually a cavity, and the tooth can heal itself. Case closed. Verdict number 2. Symptomatic irreversible pulpitis. In this case, the evidence shows the inflammation has just gone too far. That strong, lingering pain from the cold test? That was the nerve's confession. It can't heal on its own. To save the tooth, the recommended course of action is a root canal treatment. And verdict number 3. Pulp necrosis. The nerve is no longer alive. This is the diagnosis when the tooth gives zero response to that cold test. The nerve has died, usually as a result of untreated pulpitis. The case for the nerve itself is closed, but the investigation, it isn't over just yet. Because that can lead to our final verdict, symptomatic apical periodontitis. This is what happens when the infection inside that dead tooth escapes and spreads into the surrounding bone. Remember when tapping the tooth hurt during the percussion test? This is why. The problem is no longer contained within the tooth. The crime scene has now spread. So, the mystery is solved, the diagnosis is in. The question on everyone's mind is, of course, what happens next? And the answer depends entirely on that verdict, because every single test and every single question has led to this one crucial moment. And that is why all this detective work is so vital. A precise diagnosis is everything. It's the difference between needing a simple filling and needing a root canal. It's this fascinating process that combines science, experience, and the art of listening very carefully to the story your tooth is trying to tell you.